Hello, thank you for joining me. This is Dr. Erica. I am a pharmacist and I am going to talk about dry powder inhalers. Powder inhalers are inhaled powders that are inhaled very slowly so that the powder can get down into the bronchioles of the lungs. So it is for those patients who deal with emphysema, COPD, or chronic obstructive pulmonary disease, also patients who have exacerbations and need control of those disease states throughout the duration of the disease. They're having to take these inhalers on a regular and daily basis for prevention of exacerbation. So those inhalers are going to include twist inhaler. Also, it's going to include the diskus, and it's going to also include the flexhaler. Okay. For example, if you're taking a medication such as Spiriva, that is a good example of a discus inhaler. And what you're going to do is you're going to take the round burger shaped inhaler, you're going to hold it like a burger, and then you're going to actually actuate it or push the click button to make sure that medication is going to be released. And then once you hit the click button, you're going to hold it like a hamburger, seal your mouth around the mouthpiece, and inhale very slowly. Hold it for about 5 to 10 seconds, release, and exhale. Okay, and then you're gonna, after using the inhalers, because they may contain medication left in the mouth from inhaling, or it may contain some steroids. You want to wash the mouth afterwards to prevent infection, fungal infection, growth of bacteria, and so forth. So you want to make sure that when you're using the inhalers, that you're actually washing and rinsing afterwards to prevent, again, any infections. Okay, so do be aware of that. Also, the twisthaler and the discus, those machineries are to be kept away from moisture. They're to be kept away from water supply. So do keep them in dry, cool places, and be sure to be compliant and adherent. The more compliant, the more adherent, then the more the effect and the better the outcome, and less need for hospitalization, things like that. So I left a video in the description that talks about how to use the inhaler. Please look at that video. It gives a great demonstration from the Lung Association awareness. And please take a look at the video. It's very informative. It's going to show you how to use the inhaler. I think it's the Flex haler that they have in the video. So please take a look. I want you to definitely look at the demonstration. I don't have a discus on hand, but if I did, I would be able to show you in detail. So this particular video that I have linked in the description box does give that information and how to properly use the inhaler. Okay, so do be aware of that. Those patients who have bronchitis, emphysema, COPD, even asthma patients can use these medications. So I wanted to make sure that it did include a video on inhalers and spacers. And then this particular video is for the dry powder inhalers, which is a little bit different, or a lot different actually, from the regular Proventil and Ventolin and albuterol inhalers, because of the structure, because of the contents of the inhalers are very different. You have the powder inhalers versus the aerosol inhalers, and they're all used differently, and they should be used properly for the best effects. I wanted to make sure that I did include this particular video for those who are taking the dry powder inhaler. And also, please, again, look at the link in the description box and visit that link as well. Okay, so these items, again, should be kept away from moisture. They should not be washed. You can take a damp, maybe a small damp cloth to wipe around the mouthpiece to make sure there's no buildup in the mouthpiece area of the inhaler. and that's the most moisture that can be introduced there. They do come with package inserts on how to cleanse, how to utilize in detail, so do take a look at that. Um, Also, these inhalers are very expensive. I will say that if you have prescription insurance, Medicare Part B, Medicaid, commercial insurance, then you can use those to take care of the coverage of the costs. But usually out-of-pocket costs for these can run close to $400, $300. So do be aware that these inhalers are very expensive, and they are very well manufactured and good quality inhalers. So they do come with a cost, and they also work very well to prevent exacerbation, prevent hospitalization and mortality. So I do recommend them if you have a prescription and are having insurance issues. Then you can check with the website of that particular inhaler and see if there's a coupon, manufacturer's coupon that's available that you can introduce to the pharmacist, and they can go further with activating the coupon and application of the coupon for you. Okay, and also talk with your pharmacist about demonstration, about how to use the actual inhaler before you leave the pharmacy. The pharmacists are there to help. They're willing and able to actually give demonstrations and help with skills. So thank you for joining me on this particular video. Like, share, and subscribe. My name is Dr. Erica, pharmacist. I'll see you on the next video. Take care. Bye-bye.